The Collaborative Centre for Genomic Cancer Medicine is a joint venture between the University of Melbourne and the Peter MacCallum Cancer Centre, bringing both organisations' world-leading experts in cancer, genomics and precision medicine into a unified group.
The history of the partnership between Peter Mac and the University of Melbourne goes back to Sir Peter MacCallum himself. This new collaborative centre, I think, is really the icing on the cake for what has been 75 years in the making.
Our goal is to give all Australians access to genomic cancer prevention strategies, testing and personalised treatment options.
This will be the first national example of an academic-enabled genomic centre embedded within a cancer hospital. This will offer end-to-end precision cancer medicine from bench to bedside.
Precision medicine is where we use molecular testing and looking at your DNA blueprint to actually inform how we might improve your care. So we treat an individual rather than thinking about how we might treat a disease. Combining the Peter Mac's and the University of Melbourne's genomic and analytical expertise, the Collaborative Centre is harnessing the potential of disruptive technologies to transform cancer pathology.
I think what makes the centre unique is the bringing together of the expertise and the talent in the areas of particularly molecular pathology and bioinformatics. We've got human resources, human talent that are really top of their game.
Genomics is helping us understand cancers more effectively. If we can understand the features of a cancer, then we can plan treatments more effectively, and we hope that this will ultimately lead to better outcomes for our patients. A liquid biopsy is a blood test that we can utilise to obtain information about a patient's cancer. We know that short fragments of DNA from the cancer can be released into a patient's bloodstream, and we can take a blood test to study this cancer DNA and understand features related to the cancer from that simple blood test. And we can repeat these blood tests regularly during someone's management to understand how the cancer is changing over time, and that will hopefully allow us to treat the cancer more effectively. Within the centre, I have a very close collaboration with Associate Professor Richard Tothill. Here we're looking at the implementation of liquid biopsy approaches for a particular type of cancer called carcinoma of unknown primary.
Cancer of unknown primary is a broad collection of different cancers, but they all have one thing in common, is that the primary cancer, or where that cancer arose in the body, cannot be identified. In approximately 5% of cases, traditional pathology is unable to identify where in the body a cancer is originated from, meaning approximately 2,500 Australians per year are diagnosed with cancer of unknown primary, referred to as CUP. Many of these difficult to diagnose cases come from the world-class CUP clinic at the Peter Mac. Together we have pioneered genomic testing for hundreds of CUP patients recruited from around Australia. So we can harness this technology to help identify the primary origin of a patient's cancer, therefore resolving a cancer of unknown primary. Diagnosing where a cancer has originated in the body is a high priority for both patients and their treating clinicians. Treatments can differ substantially based on the type of cancer someone has, while failure to accurately diagnose the primary origin of a cancer can restrict access to certain types of medicines and optimal care. Genomics-driven personalised care is an incredible opportunity to create better patient outcomes and a more equitable healthcare system.
So in 5 years' time, I hope that what we've achieved is the development of new genomic testing that will become mainstream for all Australians.
Our goal is to lead the integration of genomic medicine into the standard of cancer care here in Australia.
The rich talent that we have in this precinct. I'm talking about people talent here, people with really innovative ideas, with a drive and a passion, and to bring them together and to place them in a situation where everything is possible, where the sophisticated equipment is available, where the resources are available, and more importantly, where they've actually been given the impetus by leadership across Peter Mac and University of Melbourne, given the go-ahead to go and actually do something really big, really bold, really innovative. That's what excites me the most.
The work going on in the centre will improve diagnoses, it will optimise care plans for individuals, and it will accelerate access to these new advances in cancer care for all Australians.